community presentation is on syphilis. The contributors are Akila Jackson, Michelle Rent, and Amber Dickey. Our objectives today will be: what is syphilis? What is the prevalence? What are the stages of disease? The risk factors associated, preventative measures, community resources, Healthy People 2020, and then at the end will be references. So what is syphilis? Well, the CDC defines syphilis as a sexually transmitted infection that can cause serious health problems if it is not treated. Syphilis is divided into stages: primary, secondary, latent, and tertiary. There are different signs and symptoms associated with each stage. As I said before, syphilis is divided into stages with different signs and symptoms associated with each stage. A person with primary syphilis generally has a sore or sores at the original site of infection. These sores usually occur on or around the genitals, around the anus, or in the rectum, or in or around the mouth. These sores are usually, but not always, firm, round, and painless. Symptoms of secondary syphilis include skin rash, swollen lymph nodes, and fever. The signs and symptoms of primary and secondary syphilis can be mild, and they might not be noticed. During the latent stage, there are no signs or symptoms. Tertiary syphilis is associated with severe medical problems. A doctor can usually diagnose tertiary syphilis with the help of multiple tests. It can affect the heart, brain, and other organs of the body. So let's go ahead and look at some facts in regards to syphilis. How common is syphilis? Well, during 2019, there were 129,813 reported new diagnoses of syphilis, all stages, compared to 37,968 new diagnoses of HIV infection in 2018 and 616,392 cases of gonorrhea in 2019. Of the syphilis cases, 38,992 were primary and secondary syphilis, the earliest and most transmissible stages. In 2019, the majority of syphilis cases occurred among gay, bisexual, and other men who have sex with men. Specifically, men who have sex with men only and men who have sex with men and women accounted for 47% of all primary and secondary syphilis cases, as well as 56% of all male primary and secondary syphilis cases. However, in recent years, the rate of primary and secondary syphilis has been mostly increasing among men who have sex with men, as well as heterosexual men and women. One may ask, how do people get syphilis? Well, syphilis is transmitted from person to person by direct contact with a syphilitic sore known as a chancre. Chancres can occur on or around the external genitals, in the vagina, around the anus, or in the rectum, or in or around the mouth. Transmission of syphilis can occur during vaginal, anal, or oral sex. In addition, pregnant women with syphilis can transmit the infection to their unborn child. How quickly do symptoms appear after infection? Well, the average time between acquisition of syphilis and the start of the first symptom is 21 days, but can range from 10 to 90 days. If we were we're looking for signs and symptoms in adults, what would we look for? Well, syphilis has been called the great pretender, as its symptoms can look like many other diseases. However, syphilis typically follows a progression of stages that can last for weeks, months, or even years.
In the early 2000s, health officials believed syphilis was close to eradication in the United States. Unfortunately, there has been a rise in syphilis transmission, with San Joaquin County ranked second in the highest infections in California after San Francisco County. San Joaquin County had an incident rate of 50.9 positive cases per 100,000 people in 2017, with a total of 381 cases. That's a 40% increase from the amount of cases in the previous year. In the primary stage of syphilis, a painless sore measuring 1 to 2 centimeters may show up on the penis, penile shaft, cervix, labia, anus, tongue, or fingers. Oftentimes, people disregard these sores, assuming they are ingrown hair. The sore leaks infectious fluid, has a raised border, and a moist base. The sores can appear up to 3 weeks after exposure to the infected person. About 3 weeks after initial infection, the sores heal, but the infected individual may display signs and symptoms of a symmetrical, non-painful rash with distinguished borders. They may also experience fever, malaise, and a macular, papular, or pustular lesions. These lesions may be 0.2 to 2 centimeters in size, pink, copper, or red, and have scales that flake. In the third stage, or latent stage, all previous symptoms disappear. The individual has no signs or symptoms of infection and is not contagious. However, the pathogen can be silently damaging organs and tissues inside the body at this time. In the fourth and final stage, known as the tertiary stage, the untreated syphilis infection may lead to death due to the effects it has on the bones, heart, skin, liver, and brain. Gumas, also known as gummy tumors, release a viscous gum-like pus. These are painless yet extremely destructive, rubbery, tumor-like growths of tissues which can begin to form in any organ, but they mainly appear in the bones, skin, and mucous membranes. They can affect organ function and cause tissue destruction, with central necrosis and an ulcer with drainage that can be thick and stringy. Untreated syphilis may also lead to meningitis, blindness, dementia, heart problems, and other severe symptoms. This final stage can occur anywhere from 1 to 46 years after exposure. People who are at higher risk for contracting syphilis are homeless, or those who lack insurance, those who have at least one other infection, lack of education, money, lack of medical access, and then plus the use of cell phone dating applications puts people at a higher risk for infection. Syphilis is a curable and treatable disease. Realizing that anyone can be infected with syphilis, no matter their status in life, is the key to reducing the occurrence and the spread of the disease. Of course, abstinence and condoms are the most assured way to prevent syphilis infection, but awareness is number one. Don't be afraid to ask to be tested so that the disease can be caught and treated early. Also, informing those who were exposed is important so that they can also get treatment. Then, sticking to the treatment is very important in order to reduce the possibility of the pathogen continuing to fester in the body.
San Joaquin County has a number of public health clinics that the community can go to if they need any information about STD testing or if they need an STD test to be performed. Stockton has several of them in their city. Also, Tracy and Lodi each have a public health clinic. And Manteca, for the Manteca residents, there is a clinic on 124 Sycamore Avenue. So in order to receive treatment from these clinics, you do have to call and make an appointment. There are no walk-ins allowed. Thus, the insured individuals of the community may also go to their own primary care providers to receive care and treatment, and also information about syphilis and any other STDs. The benefits of the resources mentioned in the previous slide are the fact that these clinics provide the community with free and low rate services. The majority of the community do qualify for free service. These clinics also provide free condoms to help reduce the spread of the syphilis infection. They also provide clients with free education about the disease. They give pamphlets, and you could speak with someone about syphilis if you are not aware of the infection, what it is, how it is spread, and how it is treated. And these clinics also provide education on current disease incidents so we can know how many people are actually getting infected with this disease in our community. It is important to know. And when people are more aware of what is going on, it gives them that sense of fear, a sense of responsibility, to where they are more prone and more active about protecting themselves and protecting their partner or partners as well. So being aware of the amount of incidents of disease, being educated, being provided with the free condoms, and being able to afford to go to these clinics are very beneficial to the community. The health disparity related to Healthy People 2020 pertaining to syphilis was the category STD8 to reduce congenital syphilis. The target was 10.7 new cases of congenital syphilis per 100,000 live births were reported in 2008. With that, there was a target setting method of 9.6 new cases per 100,000 live births. So the goal was to reduce the amount of congenital syphilis infections from 10.7 to 9.6 per 100,000 live births. And with that, there would be a 10% reduction in infection, or 10% improvement.
Thank you from Akila Jackson.
And thank you for listening from Michelle Rentz.
And thank you from Amber Dickey. Have a great day.